011.
Good morning. Clyde Dickerson. Probably the biggest issue with me is when this bill became presented to the public is the fact that I don't trust the government. But where I'm coming from is when I signed up for Medicare D, the very first year I find out that the portion that I pay out of my pocket towards my medication, that portion added to what the insurance company paid me got me up to the $2,700 donut hole. It was never made clear that first year. It was just laid on you when you got into the pharmacy. That's part of my reason why I don't trust the government when it comes to Medicare or anything like that.
Well,
the question.
Yeah. Why is this going to be any different?
Yeah. And then what you just said about the doctors is a doctor, when we go in to see him, going to say to another Medicare patient, based on that, if I'm not paying any copay, is the doctor getting cut shorter?
No, doctors pay. Here's one reason why like the American Medical Association endorsed this bill. Nurses, of course. We have a patchwork. Now, at best, there are many, many holes in it. I'm so thankful for healthcare providers for providing all of the free charity care, seeing people when they know they're never going to get paid. Now, the push, and Doug and I dealt with this in the state legislature, is how to make sure Medicaid reimbursement was adequate. And, according to healthcare providers, it doesn't pay full cost. But Medicare reimbursement is significantly higher. But what this broad policy is to say, when we have 40-some million people without insurance in this country, and to give you the number for our area, 71,000 people, that these are folks that are relying on the charity of everybody and the good graces of the community to provide coverage. Now, I don't really believe there's such a thing as free health care. We all end up paying for it. And I think one of the reasons why you're seeing healthcare providers support this bill is that virtually everyone's going to be covered. And I am a big believer in the concept of insurance. It's like auto insurance. And at one point or another, everybody's going to be a patient. And again, there with the grace of God go any of us being diagnosed with cancer, or being in an accident, or having a lengthy hospitalization where you're not going to be paid for. So I think providers like this because they know they're going to be paid. That the person coming through the door is going to be covered.
It's not just a provider issue. It's also a very important issue for Medicare enrollees. Scheduled for this coming year would have been a 21.5% cut in physician reimbursement for Medicare beneficiaries. It's tied to something embedded in current Medicare law called the Sustainable Growth Rate, or the SGR. Congress has delayed implementation of the SGR one year after another year after another year, but has never fixed the formula. There was an effort to fix the formula, but that failed on along partisan lines. What 3962 does is provide one more one-year fix. And hopefully we'll get to the point where we can actually change the sustainable growth rate. If that 21.5% cut had gone into effect next year, it not only would have impacted providers, trust me, it would have impacted patients as well. not have accepted Medicare patients into their practice because they couldn't afford it. This is a critical issue for our membership and one that we will pursue with as much energy and as much passion as the AMA.
Just to your sort of fundamental question, why should you feel that this is going to work? I work part-time in Washington. I come home every weekend. I work for you. Okay. My job is not to defend the Department of Health and Human Services or the president or that matter. My job is to fight for you. Now, I read this bill, went through it with a fine-tooth comb, and yes, we have a complicated healthcare system, and turning it is like turning a battleship. Not easy to do, but and I've long been a prevention advocate, whether it's running Head Start or sort of pay now or pay later. We have got to align incentives in the system to change healthcare. Okay. We have a fee-for-service model where providers get paid on the number of services they provide. We're not paying for outcomes. We're not paying for quality. That is realigned in this bill. It supports things like primary care medical homes, accountable care organizations. In shorthand, what that means is rewarding doctors and hospitals and hospice providers and long-term care and home care to actually work together to focus on the patient. Now, it takes a lot of pages to write some of this, and a lot of it is increased reimbursements here to do this, some rewards there. But one of my principles in supporting this bill was, can it really work? And I believe that it can. And the test it will be a test of time, but I didn't support Medicare Part D when it was enacted for some of the reasons we talked about today. But don't take my word for it. AARP is here because they think it's more than a step in the right direction.
Well, AARP did endorse the Medicare Modernization Act. We're an organization that focuses on issues, not partisan politics. Excuse me?
Is it true that you're going to get fees of excess of $200 million?
From insurance sales?
Your insurance.
AARP has a for-profit entity called AARP Services Incorporated. AARP Services Incorporated contracts with insurance companies and endorses certain insurance products that meet rigorous standards of quality and service for our members. RFPs are put out, and in exchange for that endorsement, AARP does receive a royalty. And 90% of every dollar that ASI raises is returned to the nonprofit side that enables us to provide pre-tax service to elderly people, that enables us to
That's what
provide...
you use the money for. It's the fact that you receive fees for.
The answer is yes.
The answer is yes, but it requires some
Let me say this. AARP has to follow the same rules as everybody else if they're a provider on the